direct observational therapy system that a patient being diagnosed with TB, they go to clinic kesihatan. So in front of a medical personnel, they have to eat the medication. This is to make sure that our patients are compliant. Yeah.
Almost like a prison.
Yeah.
But that's the thing. Even with sometimes, like for instance, you give them a simple infection, a bacterial infection. You tell them a week, maintain your antibiotics for a week. Even that one also people cannot listen to. But then you give them 6 months, it's going to be a tough time. So I love the fact that you're making them come to the clinic, take the medicine, eat it, and then you go back.
Yeah, but don't worry, not all patients we make them to come to clinic. We now, with our AI and all this advancement, we are offering them virtual dots where they can actually take the medicine at home, but in a Google Meet platform, for example. So in front of the medical personnel, they can still take the medication. We are making everybody's life easy.
Yeah. And then they'll give you a gold star at the end of your 6 months attendance. So that is very important. Tuberculosis. Now, I'm worried when you said that is the drug-resistant version, because tuberculosis does kill. And as you said, 30% do pass on from this disease. Tell you what, doctor, we're going to take a short break. And once we come back, we'll talk about protecting ourselves from tuberculosis and all of that. By the way, if you guys do have questions, our TikTok is currently live, and we'll be more than happy to field those. And right now, let's get a couple of songs in, and we will be right back. Don't you go anywhere. This is TRAXXfm. We are with Dr. Megalah, the tuberculosis program manager with the Gombak District Health Office, Ministry of Health. We're speaking about tuberculosis, the silent comeback. Are we ready? Welcome back to TRAXXfm. This is Health on Traxx. We are talking about tuberculosis, the silent comeback. Are we ready? Today, our panel is Dr. Megalah, who is a tuberculosis program manager with Gombak District Health Office under the Ministry of Health. Now, we have a number of questions on TikTok. Now, the first question, I think it's a simple question. Najib asks, is TB a hereditary disease?
TB is not a hereditary disease. So it's an infectious disease, like how we get a sore throat, just like that. So anybody can get.
Okay, and he also has another question.
Yeah.
Now, he understands it's airborne, but where does the bacteria even originate from? I think he's trying to find patient 0 or something.
Oh, okay. So this TB has been with us like from past. We if we can recall back our history in time of medieval and kingdoms and kings, you can recall back they had TB, right? So it's an ancient disease. Now, once a person is infected, in the air droplet, there will be the TB bacteria. So when they cough, sneeze or speak, so it finds another host, especially in a confined, closed environment. Just like, during our COVID-19, this is any airborne disease per se, that's how it spreads.
Now, TB actually had a different name back then. I think it was called consumption. Yeah, and because people just wasted away, if I'm not mistaken. I might be wrong, Google it up, but you know what? I think that's what it was. But Kuldeep also shared something. He said he had a friend who came back from Sydney and had cough for a couple of months, did the sputum test and indicated there was TB. Now, this was with family as well as himself. They also did, but found out that only his friend got it negative out of 7 people. And, right, so I'm not too sure about the rest, what he said about accurate 4 and accurate 2. I'm not too sure what those are, but I think, doctor, maybe you can tell him why only his friend got TB out of the rest of the people who went together with him.
First of all, I'm happy that all of them went for their contact screening. So when we are talking about someone tested negative, we don't know whether the person is tested negative for the active TB. Probably the rest of them may be latent TB infection. We do not know the status. So that's one thing. And it is a complex situation where if let's say that we are living with a patient of TB, when you test, there are individuals who are living in the same house, but they test negative for both active infection and also latent TB infection. This all depends on the person's immune system, how good your immunity, your immune system is. So it's complex to say why a person can, susceptible to the infection and the other person is not susceptible. So that's why very, very important is to do the close contact screening. So if any individuals get letters from the Inspector Kesihatan to go and do the screening, yeah, they should do it.
So they'll get letters?
Yes.
Not phone calls?
Not letters, it's actually notice.
Notice. What color is it? Red?
Yeah, it's actually, this is also under Akta 342. This is, under penguatkuasaan. So, yeah, the inspectors will give us a notice actually to go for the screening.
Yep.
Yes.
Akta 342, that is, make sure you go read up about that. Right. So, and Wow, Kuldeep has a lot of questions. Kuldeep, you know what? We'll get back to you in just a bit because I'm trying to find ways of understanding. Is it a question? Is it a statement? Maybe you could post it up in a proper format. Like, ask the doctor, what do you want to know? Because you're putting up an essay and I don't understand what exactly you're trying to ask. But right now, let's ask the doctor. Now, this is an important question. How do we protect ourselves from tuberculosis?
Okay, so this is an airborne disease, right? So when we are having cough, we have to practice cough etiquette. That's number one. So we've been like coughing, please wear a mask when we are in public space or even with our family. Practice wearing mask when we are, having cough and it just doesn't get settled in 1 or 2 days because we don't know what the diagnosis could be. I'm not worried about TB alone. It could be other contagious diseases like influenza and whatnot.
The
right?
rise of other flus.
Yeah. So that's number one. So number two, we should be looking into early detection, especially if we belong in the high-risk group category. High-risk group category are individuals who have comorbids like diabetes or in a prolonged immunosuppressant, prolonged steroids, patients who's going through hemodialysis, kidney failure patients. Whoever consider themselves to have weakened immune system, they should go for screening, this early detection. So how we can do this? Actually, all our clinic kesihatan are doing the screening, can set appointment with them to go and get yourselves checked. Yeah. So hereby I would also would like to talk about the tests that we do for TB patients. Yeah. So if a person comes in and say they want to do TB screening, number one, we will do the chest X-ray. Chest X-ray will show us whether the patient has active TB disease or not. If the chest X-ray is normal, we still have to do other tests, like we have TB, tuberculin skin test, or also known as MEN2 test. So we will inoculate tuberculin on skin. After about 48 hours of inoculation, we will do the reading. If the individual shows positive reaction towards the inoculation site, then we will say the person is showing a positive result. So once when the TST or the MEN2 test is positive, there's a two possibility here. The patient can be active TB or possibly can be latent TB infection as well. So the next, if the patient is symptomatic, of course, we will check the sputum. Sputum, when we expectorate, if we are infected, under the microscope, we can check for the bacteria. This is what we call acid-fast bacilli test. Yeah.
So is it only, like for instance, you said sometimes active and latent, right? Would the one single test be able to identify even if it's latent?
Okay, so for latent TB, the criteria number one is the patient is asymptomatic. Number two is the chest X-ray is normal. So once these two, we know they don't exhibit any symptom and the chest X-ray is normal. So when we have a positive MEN2 result or positive skin test, then this shows that the individual is a latent TB infected person. And also, if there is another test, blood test, known as quantiferon or IGRA, we can also test with that. If a quantiferon shows a positive result, means the patient most likely. So the patient is not having any symptom, but if we detect that the patient is having LTBI, they can actually opt for treatment. So that typically about 3 months, can go up to 6 months. Treatment for this patient, they have to be compliant. So, you don't have any symptom, but you're on medication. So you have to, work with your medical practitioners to ensure that the treatment is complete. By doing this, we are actually bringing down the likelihood from developing active TB once when our immunity becomes weakened. So that's a plus point there.
Please go on.
This is how we are actually, the early detection help us with bringing down the TB cases, the active TB cases. So what we see as the active TB cases is like as if the tip of the iceberg. What's down there are the latent TBs, because the latent TBs exhibit no symptoms. So now this group of people have to go and do their screening. Yes.
So if you even suspect that you're close contact, please do your screening.
Yes, please.
Yeah.
Although you don't get any notice, but you think you need to test yourself, please make your appointments with the nearest clinic kesihatan and go for it.
And this is the question that I think we need to ask: how expensive is TB?
The good news is under KKM, TB treatment is free. So even if we are talking about foreigners, once the TB diagnosis is being established, TB treatment is actually free. It's subsidized by MOH, right? So the cost is under KKM. It's just that for foreigners, when it comes to drug-resistant TB or requiring second line or third line therapy, then it's not free anymore.
Oh,
But for Malaysians, it's free.
all the way.
Yes.
All right. Okay. So this we have a question plus statement from Kuldeep. Now I'm gonna try and make head or tails out of it, but doctor, I'm gonna read it out.
All right.
All right. Now, this is the guy who went to Sydney, right? So he said his friend was on first phase Accurate, AKURIT. I believe that's a medicine name.
Accurate, yeah. True.
Accurate. But on the next phase, Accurate 2, he developed skin rash. After some time, medication changed, which was not in combination. Now, how many days is the stage? Is it 112 days or more? Because he was there for 4 months. I think oh my, this is right. So
it's complex there. Okay,
Yeah.
let's just look at the typical infection, right? So we were talking about 6 months regime. So in that 6 months, you have 2 months of intensive phase and 4 months of maintenance phase. So during the intensive phase, you will be taking Accurate 4, and during the maintenance phase, intensive phase is Accurate 4. Maintenance phase, you'll be taking tablet Accurate 2. Yeah, and if once the patient develop a skin rash or any other side effects, they will go for loose pills. Yeah, so this is a bit complex. This is when the respiratory physician will have to tackle case-to-case basis.
Because he said 28 days per cycle, then over 4 months should be 112 days. But the doctor says 126 days. So this is a complex case, so the doctor is taking it as he goes.
Correct.
There we go, Kuldeep. I think we got your answer. Sorry, I had to make head or tails out of that as I was doing the interview. So I had trouble there, but sorry about that. So, doctor, why are we still talking about tuberculosis in 2024? As far as we know, this is an ancient disease. It's been around for hundreds of years, if I'm not mistaken, right? So why are we still talking about it today?
Because it is still here. We are talking about it because it is still here, unfortunately. According to Sustainable Developmental Goal by WHO, right? So goal number 3 is to eliminate TB by the year 2030. How
5 more years.
Yeah. So it's actually, to be practical, it looks like far from reach. One of the main reasons is because of COVID-19 pandemic.
Yep.
During that time, we had a major setback where people, under the movement control orders, they don't go to hospital. So there was a significant decline in case detection rate. So now COVID-19 has settled down. So TB surfaces again, and this is the issue right now. So we have to talk about TB. So we have to bring to the media, like what TRAXXfm doing today. Kudos to TRAXXfm.
Oh, thank you.
So bringing on TB. So everyone listens to TB. So we all know we are living with TB in Malaysia today.
Absolutely. And it is a dangerous disease. Could affect your elderly at home. Could affect the young.
True.
Because they are most at risk as well. Because for the kids, well, the immune system is just not there yet. And for the adults, the immune system is already going.
Yes.
So, So we have to be very careful, especially bacterial infections. Now, before we end for today, Doctor, I think I've asked all the questions I think I wanted to ask, or I remember to ask. But before we go, any additional message from your end you would like to share for our listeners?
Okay, last but not least, I would talk about maintaining healthy lifestyle. That is the key for keeping our immune system at optimum level, right? So eat right, stay fit, and with the awareness of TB, hopefully we can end TB.
All right. No smoking, no vaping, no nothing.
Yes.
All right. With that, let's end the show for today. Thank you so much, Doctor, for joining us.
Thank you, TRAXXfm.
And we hope to have more of you in the future as well. Maybe next year we'll talk about it on the day itself. We'll do a program together.
Why not? Thank you so much, KJ.
All right. Have a good one. And for our listeners out there, World TB Day was on the 24th of March 2025. And also the Selangor Health Department celebrated on the 21st of April, just literally last week at NIH Setia Alam alongside MAPTB. All right, so with that, it's about time. Right, last question. Is it still fatal even though it's curable?
Yes, especially if it's late presentation. Yeah, so the earlier we go to the doctor, the outcome is better. That's my message for today.
All right, Najib, I hope that answered your question. Next time I'm going to send you some, our topics. You are going to create questions for us as well. And Kuldeep says, thank you so much, doctor.
Thank you, Kuldeep, for the questions.
All right, with that, thank you so much. Thank you for listening. Tuberculosis, the silent comeback. Are we ready? With our panel, Dr. Megalah from Gombak District Health Office, Ministry of Health. And with that, it's about time we end. I'll be back in the next hour after a bit. Don't go anywhere.